Quiet communities.
Over the past 45 years, I have listened to many people talk about how much they're suffering. What do we do about it? I'm looking forward to the speakers today who will address the scientific link between noise and adverse health.
First, people affected by aviation noise are experiencing loud, penetrating, repetitive noise at low altitude, and this is happening during the night as well as during the day. Second, people's health is being affected by sleep disruption, emotional distress, and physical manifestations. The point is that this is a serious health problem, a national public health problem. It's something we knew 50 years ago. However, many people, including policymakers, are not aware of the insidious effects of noise as well as pollution. Referring to aviation noise as an annoyance and using inadequate metrics trivialize the problem and will not bring us to any meaningful solutions. This conference is about connecting the dots to understand and gain clarity on the problem so that we can adequately address it. And we also need effective federal noise legislation to help us. So our first panel today is comprised of some of the top researchers and clinicians who are concerned with aviation noise and pollution in general. First, I would like to introduce Dr. Nilakshi Huda from Tufts University. Dr. Huda has done pioneering work to advance our understanding of community and health impacts from aviation pollution.
So good afternoon, everybody. I'll talk briefly about the impact of aviation emissions on air quality and associated health effects in near airport communities today. So when we conducted measurements of ultrafine particles at LAX or near LAX or even farther away from LAX, this is what we found. This is a map of ultrafine particle concentrations, wherein the higher concentrations are shown in darker colors and lighter colors represent low concentrations. You'll see that the pattern is such that the highest concentrations are found underneath landing jet trajectories, aligning with the downwind direction the wind at LAX blows from west-southwest. The higher concentrations can be 10-fold higher compared to the clean background near LAX, but even around 12 miles away, they were 3 or 4-fold higher than the urban background. Hence, the key finding that I was going to expound on, the adverse impacts of aviation emissions on air quality extend over areas that encompass large populations, and they extend over large areas near big airports. Adverse health conditions are prevalent at higher incident rates in near airport communities. This has been shown for a range of health impacts. The one that I want to focus on today are preterm birth and brain cancer. For mothers that were living within 15 kilometers of LAX, and we assigned those exposures for a large data set, about 175,000 mothers or pregnant people between 2008 to 2016, to understand whether or not exposure to higher ultrafine concentrations, specifically of aircraft origin, had any effect on preterm births. And we found that preterm birth rates among mothers exposed to ultrafine particles from jet exhaust were actually higher, about a 32% higher chance for those that were exposed to the highest levels of pollution compared to the lowest levels of pollution near LAX. Similar models were then used to study exposure for a multi-ethnic cohort near LAX or around the LAX in Los Angeles region, and we found an association between airport-related ultrafine particles and a risk of malignant brain cancer. About a 12% increase in risk per interquartile range of exposure. So if you divide the entire subject here in 4 bins, so as you jump from one bin to the other, you go one up in interquartile range, there's a 12% increase in risk. We found that if you did this analysis, stratify that by race, for the African American subgroup, that had the highest exposure, the malignant brain cancer risk was actually 30% higher for each interquartile range.
Thank you, Nilakshi. So now I would like to introduce Dr. Matthias Basner. Dr. Basner is Associate Professor at the University of Pennsylvania's Perelman School of Medicine. He's a leading researcher on the effects of transportation noise on sleep and health and an advisor to the World Health Organization.
So I've been doing research on the effects of noise on sleep and health for more than 20 years. So obviously sleep is extremely important for maintaining both physical and mental health. And here on this slide, you see all the negative things that can happen if we're not getting sufficient sleep on a chronic basis. And the red ones are like the psychological and mental health issues that one can develop. The blue ones are the physiological effects we see after sleep that is too short or disturbed, and the black ones are long-term health consequences down the road that have been associated with not getting sufficient sleep. And it's really important to mention that there's two components to sleep. One is the duration, and the American Academy of Sleep Medicine suggests that adults should get at least 7 hours of sleep per 24 hours every day to prevent long-term negative health consequences and to maintain high levels of cognitive performance. But there's another component, that is the sleep being undisturbed. That is, we need continuous bouts of sleep for sleep to be recuperative. And obviously, noise is a very potent disruptor of sleep because the auditory system is monitoring our environment 24/7. That is, even while we're sleeping, it's not only looking for sound levels, but also for the content, analyzing that content, and then there's a decision made whether we are woken up or aroused by a noise event or not. Okay, I know that the next slide is about the World Health Organization. They published a report in 2011 on the the burden of disease of environmental noise exposure, and looking at a number of different health outcomes. There it is. And I mean, this is like more than 10 years old, and this pie chart would look very different today, especially the ischemic heart disease number would be much bigger. But you can see that sleep disturbance is a major contributor to the overall burden of disease. You can see that in the European member states alone, annually 1.6 million healthy life years are lost due to environmental noise exposure. And again, the nighttime is a very sensitive period where we try to sleep and try to recuperate. So this is something that a lot of the complaints are generated during this period. So in conclusion, undisturbed sleep of sufficient duration is of paramount importance for health and well-being. And there are different scientific methods that can be used to investigate noise effects on sleep, all with their pros and cons. And as I mentioned, in the end, we kind of need all of them to paint the full picture. Traffic noise can disturb and fragment sleep, impair recuperation, and is likely a key contributor to long-term negative health consequences. And I didn't show what the evidence is for that, because I know that Thomas Münzel will do that in his talk. And we do need current and precise exposure response functions representative of the affected population to inform noise policy in general and limit values more specifically.
Yeah, so thank you very much for inviting me to give a presentation about noise and cardiovascular disease. I'm a cardiologist and also vascular biologist, so we can do the association between noise and disease. And I want to talk to you now, how does noise damage the vasculature in the brain? The question is also, when we have repeated noise, do we get used to it, or maybe get we a super sensitivity to vascular damage? What does it mean, noise annoyance, and does it has an impact on subsequent cardiovascular disease? And also, Matthias has mentioned it, nighttime noise and cardiovascular and cerebral damage, are they linked together? And what is the link between the annoyance reactions, mainly in the night, and subsequent cardiovascular disease. So the WHO and European Environment Agency, you have seen also some of the numbers already from Matthias. So in western part of Europe, 1.6 million healthy life years are lost every year from traffic-related noise. Nearly 130 million Europeans in towns and cities are exposed to noise levels in excess of 55 decibels, which means at the level where health side effects have to be expected. The European Environment Agency is saying that we have 900,000 cases of hypertension, 40,000 hospital admissions, 6.5 million people suffer from high sleep disturbance, which is very important because sleep disturbance is now acknowledged as an important cardiovascular risk factor. And we have this high number of group with 22 million people suffer from chronic high annoyance. Now, how is noise getting translated to cardiovascular disease? I'd like to introduce to you a paper published by Matthias Basner and Wolfgang Babisch from the Umweltbundesamt in the European Heart Journal. And Wolfgang Babisch always had the philosophy that we have two pathways of noise damage. The direct one, which means we have very high noise levels, more than 100 decibel, for example, it damaging the ear organ directly, or we have the indirect pathway, which means we have levels between 50 and 60 decibels, which reflects the communication. And this causes disturbance of activity, sleep, and communication, and we develop the annoyance reaction. So we are getting angry, which means these are reflecting cognitive and emotional responses. And this, of course, means we have stress, and we can measure that. So we see a sympathetic nerve activation. We can also measure sometimes an increase in cortisol levels. And if this is getting chronically, then you develop your own cardiovascular risk factors. So blood pressure goes up, lipids go up, and glucose levels go up. And if you have this for years, you get cardiovascular disease, ischemic heart disease, stroke, heart failure, arrhythmia, arterial hypertension. So I just wanted to show that it was not clear why this noise stress at the end is getting translated into cardiovascular disease. And we know nowadays that aircraft noise may cause hypertension, coronary artery disease, heart failure, and stroke disease. But we also know from new data from Martin Rösli that aircraft noise, in particular nighttime aircraft noise, can trigger acute myocardial infarction. That's a paper published from Apolline Saucy, European Heart Journal, and they actually established that exposure to noise levels higher than 55 decibel preceding death were significantly associated with mortality for all causes of cardiovascular disease. So when you have in the night, even Zurich Airport is not allowed to fly in the night. They have, of course, they have their exceptions, and then they realized when they have a flight in the night that 2 hours later, then this sudden cardiac event occurred, and they speculate that because of noise and an awakening reaction, stress reaction, you get an increase in stress hormone levels, you get an increase in heart rate and blood pressure, and this at the end may trigger acute cardiovascular death. And this is a very important point, that noise is not just causing cardiovascular disease, it's very strong in causing mental disease. So here noise annoyance was associated with depression and anxiety, generalized anxiety. So when you have extreme annoyance development, the likelihood to get depression or generalized anxiety was at least twofold increased. So the pathophysiology is more complex now, but we know for sure that aircraft noise stimulates, activates the brain. The amygdala is very important. We get signs for inflammation in the vasculature. We also know that the inflammatory cells are getting activated, and we see that vascular function is completely disturbed, which is actually mainly responsible for that the process of calcification of the vessel is getting initiated. So of course, we just said that sleep disturbance is a risk factor. So we're very interested whether nighttime aircraft noise is more damaging than daytime noise. It was very disturbing to me, the adverse effects on the brain. So when we have 4 nights of nighttime noise, just four nights aircraft noise, then we see that in the brain, a very important enzyme, nitric oxide synthase, the neuronal nitric oxide synthase, is getting downregulated. And this enzyme is responsible for cognitive function, memory, and learning. So, and this explains why that children who respond with increased annoyance have also a decline in cognitive function. So this is very disturbing that we see this very profound changes in the brain already after 4 days of and 4 nights of continuous noise. So in summary, I think there's no doubt anymore that noise causes cardiovascular and cerebral damage. Noise increases blood pressure and increases stress hormone release. Repeated noise events prime the vasculature for developing vascular damage. We don't see tolerance to damage development, so we see rather the opposite, that the vessels are getting more sensitive to damage. And cardiovascular damage, we just see it in response to nighttime noise. So the night has to be protected, and aircraft noise should be completely forbidden in the night, and aircrafts shouldn't start in the night. Thank you very much for your attention.
Quiet communities.